What's up, TUMNAD Lectures? In this video, we're going to be looking what we call the liver anatomy. It's the very first time to watch me. Please make sure you subscribe, you put on notification bell, such that whenever I load the video, you are the very first person to watch. So let's go ahead and get started and look at the anatomy of what we call the liver. So now, in the previous videos, we have been looking about the theoretical part of the liver, the anterior view, the posterior view. Today, you're going to be part of what we call clinical practical. So now, today, we have come with this model, okay? This model is what we call the model of the human liver, okay? So now we're going to be looking at the anatomy of the human liver. That's in the practical section, okay? So now we said that the liver is going to be that dark reddish brown organ, which is going to be residing within what we call the right hypochondriac region. Some part goes to what we call the epigastric region, with some part extending to what we call the left, what we call hypochondriac region, meaning that the liver is going to be occupying almost three regions of what we call the abdomen, okay? We said that the liver is going to be the largest gland and even also going to be the largest internal organ of the body. The liver, we said that it weighs approximately around 1.5 kilograms and it's going to be slightly heavier in male than in females, okay? And then we said that the liver is going to be one of the most vital organs, okay? So now we said that the liver is going to be divided generally into 4 lobes, okay? So now this one is going to be the right lobe. Okay, this one is going to be the right lobe, the big one. It's going to be the right lobe, and then this one here is going to be the what we call the left lobe. Super very important. So now when you see this right lobe and then the left lobe is going to be divided by what we call the falciform ligament. Okay, so now this ruminant tissue is going to be what we call the falciform ligament that divides the right lobe from what we call the left lobe. Okay, so now when we turn the liver the other way around, that's when we can see other 2 lobes. Now this big vein here is what we call the inferior vena cava. Super very important. Then when we come the other side, we also have this ruminant, which we call ligamentum venosum. This one is a ruminant of what we call the ductus venosus during fetal life. During fetal life, we used to have what we call ductus venosus that would shunt blood to the inferior vena cava. But when a baby is born, it becomes a ligamentum venosum. So now this lobe here, residing between ligamentum venosum and inferior vena cava, this lobe is what we call the caudate lobe, and then what caudate means tail. Super very important. Caudate lobe. Then when we come down here, we also have another kind of the lobe. It is going to be located between the gallbladder. This green structure is what we call the gallbladder, with this another kind of this ligament here. This ligament here is what we call ligamentum teres. Okay, ligamentum teres, or even some people call it the round ligament. It is a ruminant. Shows that during fetal life, you used to have umbilical veins passing here, but when a baby is born, it becomes a fibrotic tissue, which we call ligamentum teres or round ligament. Now, this kind of the lobe residing between the ligamentum teres and what we call the gallbladder is what we call the quadrate lobe, okay? What we call the quadrate lobe, having a 4-sided structure. Core means 4, so now this is what we call quadrate lobe. Caudate quadrate lobe, okay? Then we said that we also have different ligaments. We have what we call the posterior coronary ligament, and then what we call the anterior coronary ligament. Okay, anterior coronary ligament, posterior coronary ligament, and then on each corner you have what we call the right triangular ligament. Okay, this one here what we call the right triangular ligament, and then this one here what we call the left triangular ligament. Okay. Left triangular ligament, super very important. These coronary ligaments and then triangular ligaments, they are the one which are going to be helping the liver to cling on what we call the diaphragm. So now this face here is what we call the diaphragmatic surface of the liver. Okay, the diaphragmatic surface of the liver that clings on what we call the surface of the liver. Now this area here, it is the only portion of the liver that's not going to be covered by what we call the peritoneum. Okay, this portion does not contain the peritoneum. It is not covered by the peritoneum, and this area is what we call the baro area. Okay, it is the only portion of the liver which is not covered by peritoneum. This is what we call the baro area. Okay. Then we said that the liver also has a couple of different impressions. Impressions are going to be those grooves, which shows that the liver is always in contact with some other parts of the viscera. We said that this kind of the impression is what we call the colic impression. Super very important. Colic impression, renal impression. Okay, it means that the right kidney is going to be clinging here. Then it's going to be what we call the duodenal impression. Duodenal impression, meaning that the duodenum is going to be clinging here, and even also what we call the suprarenal impression, meaning that what we call the adrenal gland. This is the area that's where the liver is going to be in contact. Is what we call the adrenal gland. Okay. Then we said that we also have what we call the gastric impression on the left lobe, gastric impression, with some little kind of the groove, what we call esophageal impression. Super, super very important, okay? And then in the center here, we have this kind of this structure, super, super very important. This structure is going to be containing three kind of the openings. It's going to be having what we call the hepatic portal vein. It's going to be having what we call the hepatic artery proper, and then the common hepatic duct. You know how this structure is called? This structure here is what we call the porta hepatis, okay? Porta hepatis containing hepatic artery proper, hepatic portal vein, and then common hepatic duct. Super, super very important, okay? So now, this briefly covers the really anatomy of what we call the liver. And of course, the anatomical position of the liver is going to be the anatomical position of the liver, with the right hand holding on what we call the right lobe, and even also the left hand slightly coming on what we call the left lobe. So now when you position it on the right side of the liver where it's supposed to be, this becomes what we call what we call the anatomical position of the liver, because you have to be seeing the behind part of the liver. Okay, you have to be seeing the behind part of the liver. So now, having seen that, let's just have a very quick recap of what we call the anatomy of the liver. So now, this is going to be the right lobe, okay, right lobe. Then it's going to be left lobe, divided by what we call the falciform ligament. When we turn the other way around, this is going to be what we call the caudate lobe, and this is what we call the quadrate lobe. This is going to be what we call the gallbladder. Okay, this is what we call ligamentum venosum, and this is what we call ligamentum teres, which some other people call the round ligament. Okay, so now this is going to what we call the bere area, the only portion of the liver which is not covered by the peritoneum. This is what we call the anterior coronary ligament. This is what we call the posterior coronary ligament. And then on each corner, we have what we call the right triangular ligament, super very important, and what we call the left triangular ligament. So now, what we call the coronary ligament and then triangular ligament, they help to anchor the liver on what we call the diaphragm, okay? They help to anchor the liver to what we call the diaphragm, okay? So now we have said that this is what we call the inferior vena cava, super very important, okay? So now this is where the hepatic veins drain into what we call the inferior vena cava, and then the inferior vena cava drives the blood into what we call the right atrium. We said that this area which is going to be residing between the quadrate lobe, what we call the caudate lobe, and this area having the hepatic portal vein, hepatic artery proper, and then common hepatic duct. We say that structure is what we call the porta hepatis. Super, super very important, okay? So now in the next video, we are going to be looking at now what we call the portal circulation, the liver circulation. How blood is going to be flowing in this liver. Okay, that's what we call liver circulation, what we call the portal circulation. So now, how the blood is going to be leaving the spleen, how the blood is going to be leaving what we call the pancreas, how the blood leaves what we call the stomach, how the blood leaves all the different portions of the intestines, and then how it is forwarded into what we call this this kind of the vessel which we call the portal vein, and even also what we call the hepatic artery proper that supplies what we call the liver. So now, as we said that the liver has the dual supply, so we are going to be looking how the liver gets supplied with blood and how it is drained finally into what we call the hepatic vein before it is dropped into what we call the inferior vena cava as it is taken into the right atrium. So now that comes to the end of today's session, and if you think whatever I've talked is making sense, is adding to you, you are benefiting, please, you can support me, and that one can be done by a couple of means. You like the video, comment down in the comment section, and then subscribe. Thank you very much for watching TUMNAD, as always, until we meet next time.